in the budget. For example, in 2020, each eligible citizen in Hong Kong was given $10,000 cash handout. In 2021, altogether, in 2 rounds, we dish out $5,000 of consumption vouchers. And this year, we have upped the amount to $10,000 of consumption vouchers. The electronic consumption voucher scheme would help bring vibrancy to our economy. Altogether, the government has allocated $170 billion for the purpose. These 3 pillars complement each other, and we also find them being very effective. For the AEF, we have target recipients. For the businesses or premises or sectors affected, subsidies would be provided under the AEF to tide employees as well as employers over. As for the electronic consumption voucher scheme, it has a wider coverage of employees and employers. For the ESS, of course, the purpose is to keep enterprises stay afloat, and the consumption vouchers would help ease the spending pressure on general citizens. And in the ESS, in the second half of 2020, we provided wage subsidies for 6 consecutive months for 150,000 employers. They were able to keep jobs for 1.95 million employees. We also helped avoid massive closures and layoffs and avoided the businesses continuing to deteriorate. In 2021, the ESS was a major cause of a strong economic rebound. In 2021, you may recall that a 6.4% GDP growth in real terms was recorded. And as I explained just now, the unemployment rate declined from 7.2% in the beginning of the year to 3.9% at the end of the year. Today, I'd like to introduce another round of ESS. We will rely on the same framework, and we will be immediately liaising with trade associations and labor unions, and we'll be explaining our scheme to them and hearing their views. And very soon, we will be submitting a funding application to LegCo to allow Hong Kong's economy to quickly rebound from the trough in the 5th wave of the epidemic and to pick up pace in the economic recovery. We propose to introduce another round of employment support scheme, and that is ESS 2022. Drawing on the reference and the views expressed in the last round of ESS in 2020, we'll take a more targeted approach in this round of ESS to support industries directly or indirectly affected by the 5th wave, in particular SMEs. We've also drawn on the experience and the feedback from the last round and revised and improved the scheme. For example, we're going to set an upper limit of the wages of employees. For enterprises hiring employees with higher wages, they will be taken out of the list, and some sectors not hardest hit by the epidemic will also be struck out, such as supermarkets or major chain stores. And thirdly, we will require that the subsidies be directly spent on employees to make sure that the resources would be optimally used on the most necessary areas. Now, according to the MPF data or data submitted by employers in 2020, they will serve as a reference and will strive to streamline the application procedures. Now, let me highlight the salient points of the ESS 2022. Eligible employers will be provided 3 months wage subsidy between May, June, and July of 2022. Similar to the practice in 2020, the amount will be dispersed to employers. Second, only employees earning an income below $30,000, that is, adopting the same threshold of $30,000 earnings for temporary unemployment relief scheme would be adopted. That covers 75% of employees, and these bracket of employees would get the subsidy. For a full-time employee, the monthly subsidy would be set at $8,000 across the board. In 2020, our approach was that 50% of this employees would be adopted as the amount of subsidy, and that it would be capped at $9,000. From last time's experience, we understand that the actual amount was $7,800 on average, and this time we will set the amount at $8,000 across the board. And what is different this time is that the employers can submit the number of employees eligible for subsidy to help us get a better picture of the situation, but then it should not go above the upper limit set. We're going to rely on the data received in the last ESS. For example, in ESS 2020, if an enterprise successfully applied for subsidy with 1,000 employees, this would become the upper limit for ESS 2022, although the enterprise may not be still having 1,000 employees. If by the time businesses thrive again, and they employ 1,000 employees, they will be eligible for the same amount. We'll also consider whether all employers and eligible subsidized employees should observe an upper limit. As you know, we have major corporations in Hong Kong hiring several thousand employees. And in the last round, all employees were eligible, at least they could apply for ESS 2020. Now we're of the view that focus should be placed on SMEs. For major employers, we need to set an upper limit, perhaps, so that we can more evenly distribute resources instead of focusing resources on larger corporations. The fourth point is that in the 3-month subsidy period, an employer is required to employ the number of employees he first submitted and approved under the ESS. There is also a new requirement. The $8,000 subsidy must be spent on the employee. This is a clear difference from the ESS 2020, since the ESS 2020 was criticized by labor unions as the employers spent the subsidy on employees with high income and not grassroots employees. On this occasion, we will require enterprises to allocate the subsidy directly to employees. Finally, one major difference is that, having heeded the views of the community, despite this raging epidemic, not all industries are affected as severely. Some industries aren't hit at all, so some industries would be taken out of the list. In 2020, the list was quite simple. We took out public service statutory bodies such as Airport Authority and the MTRCL. These corporations were not eligible as they were somewhat related to the government, and of course civil servants would not be eligible. Other aided and subsidized organizations, tertiary institutions, were subsidized under other mechanisms, and they would not therefore be eligible. On this occasion, we are going to exclude even more industries. They will not be eligible for ESS 2022. And these are industries not hit hard by the epidemic. And like I explained just now, they include major supermarkets, pharmacies, property management companies, banks, financial institutions, couriers, telecommunications and broadcasting industries. Now, about this list of exclusions and involving enterprises and industries, we will publish another list in due course. Finally, we encourage employers to continue to employ senior citizens above the age of 65, and that these employers will be provided with the relevant assistance. Now, last time we encountered the same question. As these senior employees are not required to make MPF contributions, we need to consider how we help these employers to apply for ESS, and we'll make announcements in due course. Subject to the final exclusion list, our ballpark estimate is that the ESS 2022 will benefit 1.1 to 1.3 million employees. And comparing to ESS 2020, the number of eligible employees would be smaller. As for the subsidy amount, it should range from $26 to $31 billion, mostly because this entails a 3-month subsidy period, and we will finalize the details and submit a funding application to the Finance Committee of Legislative Council as soon as possible so that the further injection of funding can be made to the anti-epidemic fund. Our target is to start receiving application in April.
When we launched ESS 2020, I described it as something that was novel and a timely assistance. Today, the ESS 2022 is a measure to support enterprises preserve jobs as well as to boost confidence. I believe that the situation today is similar to what we saw in the past, but I'm confident that our economy will pick up and we will have a bright future. We'll now answer questions. Those who would like to ask questions, please raise your hands, identify the organization you represent, and use the microphone we give you. As usual, because of the number of reporters, please limit your questions to 3, and there will be no supplementary questions. The one in the middle. Good morning. I'd like to ask Mrs. Lam. There is something that is circulating on the internet, the division of labor between mainland medics and Hong Kong medics. And there are views saying that, jobs that are not very pleasant are given to to mainland medics, and at the same time, Hong Kong medics are given lighter jobs and more pleasant jobs. Well, do you think that this division of labor is unfair and unbalanced? And this has a demeaning to mainland medics because their jobs are equal to care workers. Do you think that mainland medics will feel bad about it? How are instructions given to mainland medics to help, say, save lives or resuscitations? So what about the latest division of labor in the hospital authority? Are there any differences? Please give us a clarification as soon as possible so that our concerns can be dispelled. I'm from TVB. This is the situation. First, our society as a whole, in relation to the support from the mainland in the form of supplies of goods, materials, as well as support of mainland medics, we are very grateful because, as you said, that mainland medics left their home and their family to come to Hong Kong to help us. We should be grateful. This is a new environment for them, and they need time to adjust. In a medical team, for those foreigners who came to Hong Kong, there was already a consensus that their cooperation will be in the form of a hybrid approach. In other words, that they do different jobs. But of course, sometimes there will be some form of division of labor. But if the division of labor is agreed upon by the two sides, I think that is not for a third party to comment on something that appears merely on paper. These medics, whether they're from the mainland or from Hong Kong, they are here to help. They are very devoted in helping and caring for COVID patients. So mainland medics come to Hong Kong to give us assistance we need to provide better treatment and to reduce the number of serious cases and fatality cases. It is of great benefit to us, and we are very confident of the help they would give us. As I said, that these people work in top level hospitals in Guangdong, and they have been to different places to assist in the anti-epidemic efforts, including places like Wuhan. And I do think that when they come to help to Hong Kong, they will find a place where they will be able to give us the most help. And that is a common goal. And I'm sure that that can be achieved with everyone's cooperation. The gentleman reporter at the back. I'm from Hong Kong 01. I have two questions. First, Mr. Xi Jinping, a chairman, said in February openly that he would like a Hong Kong SAR government to focus on fighting the epidemic. But it's been over a month. We see that the number of death cases has increased from 200 or so to 5,000. Chief Executive, do you think that in the past month you have done what the chairman of the party said, that you would do everything to combat the epidemic? And Professor David Hui previously said that there was a consensus reached with a mainland expert that when the daily infection cases has dropped to the tune of hundreds, then it's the best time to conduct the universal testing. But we are nowhere near that. What strategies do you have to reduce the number of infections daily to a free figure? We have followed the instructions given by President Xi. We have been doing our best to stabilize the epidemic. This duty has an overriding importance. Hong Kong people's safety and health is paramount to us. My daily duties include press conferences I call every day excluding Tuesday. And everything we do aims to save lives and to fight the epidemic. I do think that the Hong Kong SAR government is doing our main duty. Secondly, in relation to the timing of universal testing, well, local experts and mainland experts have expressed their views. I will carefully consider these views, and in the near future, I will make an announcement. On the 22nd of February, I floated the idea of using compulsory universal testing as a means to combat and control the epidemic. I'm afraid that what I can say to you is that we're not at the right time yet. I respect reporters' freedom to ask questions, but I'm sure that those who are watching the press conference are very concerned about the temporary unemployment relief as well as ESS 2022. If reporters can focus on these important measures so that we can inject some confidence in employers and employees.
Third question. This lady reporting in the middle.
From HKIBC. So I would like to ask about the two schemes that you have announced just now. So do they only cover for permanent residents, or if people who came here with a visa, are they covered as well? And the second question I would like to ask is, what's your expectation under these two schemes? Will the unemployment rate continue to rise, like what you have just said, like the tsunami will continue to go on? Thank you.
This scheme is intended to support employees through providing wage subsidies to their employers. So we will not draw a distinction between the resident status, ethnicity, or background of the individuals. As I've mentioned, the distinction will be drawn on the basis of the industry. So for certain business sectors which are not adversely affected by the COVID-19 epidemic, they will not be eligible. In fact, this is a very strong message given to us when we conducted the 2020 support scheme. As far as the second question, I'll invite the Secretary for Labor and Welfare to explain to you the impact of the 2020 ESS on the overall employment or unemployment situation in Hong Kong.
Well, to look at what would be the possible impact of the current proposal, the best thing is to look back at in the 2020 ESS application. Just to recap, in the 2020 ESS program, it sort of covered the period of June to November 2020. You probably remember the third wave is peak around July and August in 2020. Very likely because of the ESS program, the unemployment was rather stable at that time, at around 6.1 to 6.3%. Even though the peak of the third wave hit Hong Kong. After the end of the third wave, the fourth wave came around mid-November 2020. The ESS stopped in November 2020. Then the unemployment rate started to increase in December 2020 and reached its peak by the time February 2021, that is 7.2%. The whole purpose of the ESS back at that time is to try to keep the business afloat so that when the epidemic subsides, the industry can revise very quickly. And if you look at the figures, it clearly illustrates how quickly the economy picks up in 2021. As Chief Executive just mentioned, in the announced figure in February 2021, the unemployment rate was 7.2%. In 10 months' time, it drops to 3.9%. The best comparison is back in 2003, during the period of SARS. In June 2003, the unemployment rate was 8.5%. To reduce by 3.3%, the same magnitude that we have in 2021, it took 2.5 years before the unemployment rate dropped down to 5.9%. What it really tells us is that the rebound in 2021 is very quick. And if you look at the impact of ESS during the third wave, and then how much the business can uphold themselves, and how they can recover very quickly after this fourth wave, it illustrates the importance of a ESS program. But just to highlight the current proposed ESS is slightly different because of the timing. If you remember, in 2020, when we start announcing the ESS, it was right after the second wave, before the third wave. We didn't know when the third wave would come. So the whole idea is to keep the business afloat. But now it's like different. Now, if everything's, we can say touch wood, if the peak of the fifth wave has already passed more than a week ago, and now is the time to think about how we can keep the business coming, to help them to coming back very quickly as possible. So the design, as spelled out by the chief executive right now, is to encourage them to increase their employment, because the amount of subsidy will depend on how many employees they will employ. And so that will help the business to rebound far more quickly. That's what I say.
好，我哋不如問一問。
Right. In relation to the chief executive's remarks, let's take some more questions in Chinese. I'm from Ming Pao. Good morning. Please speak up. Yes. Yesterday, when the unemployment figures were announced, some academics commented that it was, after all, a human disaster that caused a rise in the unemployment rate. The government has been criticized as incompetent in fighting the epidemic. What's your view on this comment, Chief Executive? And there are also views in the community that if the government continues to uphold the tight social distancing measures, any relief schemes would not be able to help revive the economy and help improve people's livelihood and the business sentiment. Do you have a clear timetable about relaxation of social distancing measures to boost the confidence of the public? Please confine to 2 questions only. Chief Executive. I think I responded to this point once or twice. We have a raging epidemic, be it a member of the Legislative Council, a key opinion leader, and citizens of Hong Kong. I totally understand their criticisms against the government, and I accept these criticisms, and that's why I have been improving every day. But after all, this is a public health crisis, and we need cooperation from everyone in Hong Kong in order to ride out the storm. Basically, Hong Kong citizens are cooperative. Professor Liang Wannian, after his visit to Hong Kong, commented that we do have 3 good qualities. First, the government is striving very hard, and second, many experts are very helpful in providing expert advice to the government, and third, members of the public have been very compliant in terms of all the social distancing rules. They wear a mask in public transport. And of course, these support measures are not long-lasting. If enterprises have a bleak outlook of the economy, and if they don't have confidence, all these supporting measures will be futile. And that is why, like I explained, for the ESS 2022, we'd like to boost the confidence of employers. Once we see any hope of economic recovery, these businesses would be ready to start again. And they may even have the means to employ more workers. So we are not setting a limit. As long as they don't reach the cap, they will continue to get wage subsidy in the 3 months from May to July, and they can even get more subsidy if they employ more. And that is why the ESS 2022 is a confidence booster. But of course, the prerequisite is for the epidemic situation to be under control. And that is why the Hong Kong SAR government is striving hard. We need to reduce deaths, severe cases, and infection. On the other hand, we will continue to mount operations, including RTDs and PCR tests, RAT, and we take a triage approach in isolating confirmed cases so that we can control the epidemic as soon as possible, and that we will have the prerequisites to relax the social distancing measures, and affected premises will be able to reopen and start their businesses again. And together with these schemes, I believe that in the near future, we'll be able to see an economic rebound as we've seen in 2021.
We surpass 1 million cases today, but many Hong Kongers are not reporting their positive COVID infections, citing a lack of awareness of the rules, jammed government hotlines, overloaded hospitals, or fear of quarantine or being separated from children. Meanwhile, the authorities have warned of arrest or fines for resisting isolation. Do you fear that the strict measures and warnings of arrest are disincentivizing people from coming forward? And wouldn't this result in huge numbers of hidden cases? What's your message to those not reporting their infections? And second, you just said reporters have the freedom to ask any questions, and I think Hong Kongers do appreciate the support of mainland medics. But yesterday, a Now TV reporter was attacked by state-backed press and CY for asking a perfectly normal question about medical accountability, one that was asked by Ming Pao, AM 730, iCable TVB. You've spoken of ensuring press freedom and better liaising with the media. Will you condemn the backlash and just reassure journalists that we can freely ask anything without fear of reprisals?
About the situation of self-declaration or self-reporting, as a result of people discovering that they are positive using the rapid antigen test. So far, I'm actually amazed that people are very abiding. That's why you are still seeing a very large number of positive cases confirmed every day as a result of the RAT test. The number now actually exceeds the number of cases arising from the PCR test. And the second point is people now realize that by declaring the RAT results as promptly as possible, they are contributing to the entire strategy to combat COVID-19, which will be of benefit to the whole society, because we'll then be able to move forward to relax the social distancing rules, and children can go back to school. So that's why I said just now that in the multi-pronged approach to suppress this fifth wave, we will continue to appeal to people to use the RAT and to report promptly, and to fill in the electronic form of the Center for Health Protection, so that the health people could properly assess whether an individual tested positive could go into the CIF, the Community Isolation Facility, or they could be allowed to isolate at home and receive the home support package that we are providing them. So that was a situation. But having said that, it is incumbent upon us as a government and the law enforcement authority to tell people that there is a legal basis, whether it is quarantine under a quarantine order or isolation of an infected case under an isolation order. All these are statutory documents issued under CAP 599. That is a Prevention and Control of Disease Ordinance. So if there are people blatantly refuse to comply, then isn't it incumbent upon the law enforcement body to do something? But if you look at the figures of arrests or prosecutions, it's a very minute number, because we still want to appeal to people's cooperation and civic responsibility in order to work with us to combat this unprecedented wave that we are now facing. The second question I feel is a bit far-fetched to relate this single incident to the freedom of the press in Hong Kong. Freedom of the press in Hong Kong is safeguarded under the Basic Law, and the Hong Kong SAR government and myself as the chief executive, we attach importance to upholding the freedom of the press, as well as the freedom of individuals and so on. But I would really make this very strong personal appeal to the people of Hong Kong and also to our media friends. It is no easy task for these medical, nursing, and allied support professionals to come to Hong Kong because they all have a job in a medical institution in Guangdong. They all have a family that they want to see every night. But now they are putting down all these personal aspirations and rush to Hong Kong to help us save lives. Their working conditions are really not satisfactory. They are not working in a proper hospital. They are working in a makeshift hospital called the AWE, Community Treatment Center. They are doing it in a closed loop. They can only be commuted by designated buses every day between the hotel and the AWE treatment center. Using the mainland very stringent public health and infection control standards, they have to work 4 hours in heavy gear, non-stop, without even going to the toilet. I was told that 4 hours, a maximum tolerance of a human being in that sort of gear. So why do we want to make all this fuss and make divisive comments between the Hong Kong personnel, medical personnel, and the mainland medical personnel? So please, you can ask questions to understand more about their deployment, their contribution, and maybe there's their feelings in time to come. But don't make it into another political issue or related to media freedom and so on. But Hong Kong is as free a society as we would like to see. So there are a lot of people who've been making a lot of comments. I have been the target of a lot of comments made by opinion leaders and politicians and former colleagues from time to time. But this is the beauty of Hong Kong. Everybody has a right to express a view. But we have to put all those views in context. And the government has the first duty to explain and to point out the facts and to dispel any rumors or accusations. Thank you.
好，接住另外一位記者提問。
Next question. The reporter in the middle. I'm from Phoenix TV. I'd like to ask about the unemployment announced yesterday. Do you think that that is the peak in the fifth wave? Does the fifth wave reflect that there is a lot of room for training of people working in residential care homes? How does that affect our competitiveness? Just now you said that under the ESS 2022, telecommunication companies and property management companies, chain supermarkets will be excluded. But for these trades, they still have employees getting infected or being quarantined. So what are the criteria when you compile the exclusion list?
Right, 3 questions. For the unemployment figures announced, the period covered December 2021 to February 2022, and the figures are announced on a quarterly basis. So for the next cycle, that is for the unemployment figures between January and March 2022, it is expected to go up further. It is only to be expected, and we had a few good months during Christmas, New Year, when businesses were thriving. We couldn't book a table in restaurants, but then starting from the 7th of January, we imposed the most stringent social distancing measures, and we ordered some specified premises to close. And without having the benefit of these figures, you will expect that the figures between January and March will not look good. Now, this is exactly the reason why we roll out the ESS 2022. We hope to curb the rapid surge in the number of unemployed staff. At least we should give confidence to employees and employees alike, because in May, June, July, the employees will be receiving wage subsidies from the government to pay out to the employees. And by then, hopefully, if we're able to allow the specified premises to reopen, they'll be able to hire more hands. Another question, you mentioned whether the current epidemic situation reflects lack of training in certain sectors, and that because of the stringent social distancing measures, some people prefer to live and work elsewhere. Well, these are all accurate observations, but we need to understand the reasons behind them and what measures the government has to resolve these issues. It is beyond dispute that we have an aging society and the labor force will continue to contract. This is within our expectation. So what we can do is to continue to attract talents and import labor. And of course, it is common refrain. And of course, Secretary for Labor and Welfare can tell you that it's very difficult to hire hands from the outside to help out in care homes in Hong Kong. Each application is a thorny issue. We have labor representatives making staunch objections to importation of labor. And I think we should all stay calm and put our heads together to find a way out. That is, to resolve the acute and serious shortage of manpower in certain sectors. Now, the other point is attracting talents. Hong Kong remains attractive to talents. We have a talent admission scheme which entails a high threshold in terms of academic qualifications and personal achievements. These talents are required to meet these very high thresholds before they are granted residence in Hong Kong. Now, in the policy address for 2 consecutive years, I propose to increase the number of quotas for talents from 1,000 to 2,000 and then further to 4,000. We're able to attract mainland as well as overseas talents. Meanwhile, because of travel restrictions, there are people who are unable to reunite with their families outside of Hong Kong, and there are also people who are not able to come back, and also people who would like to take their career and their families elsewhere. I don't have any comment except that I believe some of them will come back when once again Hong Kong can showcase its competitiveness and advantages, and that we have limitless opportunities of development in the strategy of incorporating into the overall development of the country, and together with the advantage of one country, 2 systems, I have confidence that in the future we will be able to attract more talents to live and develop their careers in Hong Kong. Now, the third question is about the exclusion list under ESS 2022. You should refer to earlier media reportings. In 2020 ESS, it was quite relaxed. We only excluded statutory bodies, subsidized, subvented organizations, public institutions, etc. Other enterprises, organizations are eligible, hence attracting criticisms that we were lending a helping hand to some profitable businesses, including the 2 major supermarket chains. And I must say that in the current wave of the epidemic, the 2 major supermarket chains are actually making huge profits. Now, for some employees, because of their higher level of exposure. They are of the high risk group, and these enterprises should take better care of them, including delivery services. After introducing the dine-in ban, some businesses have really good profit by delivering their food and items, and they should protect the delivery workers as well. Anyway, you should wait for the list in the annex and raise further questions with the head of PICO. Well, although in the afternoon, she will be briefing you on another scheme called the Temporary Unemployment Relief. I believe Doris will be happy to explain further about the exclusion list. Let's take one more question from reporters on the two schemes. This male reporter in the middle back row. Good morning, Chief Executive. I have a question about mainland medical support team. In relation to the complaints against them, is it because no criticism should be made? Now, about the question put by the online media reporter, does your reply amount to an attack on the media? Now, about further adjustments to be made, what is the negotiation about? In fact, is it that the list now circulating around is just something that awaits the central authorities' approval? I'm from Epoch Times. Sorry, I don't quite catch the two questions. Right, Chief Executive, let me be succinct. First, about complaints against mainland medics. Is it because of the mainland policy that no criticisms to be made? And then earlier it was said that the CUT, comprehensive or compulsory universal testing, will be subject to further revisions. Now, is that true, or is it that for the rumors circulating on the internet, it is true, only that you're waiting for central authorities' approval? I think I answered the question earlier. We also issued a press release explaining that the information circulating around is not our CUT program. We're still ironing out the details, and we're not waiting for central authorities' approval. This is a work of the Hong Kong SAR government, only that if we are to conduct the CUT, we must have the support from the Central People's Government. The Hong Kong SAR government has the primary responsibility of fighting the epidemic. Now, we may have capacity constraints, and in the past few months, the central authorities have been providing support to us in terms of, for example, building cabin and makeshift hospitals and ensuring stable supply of goods and medical items, produce, vegetables, as well as dispatching medical teams from the mainland to help with treatment of patients. Now, the mainland medical support team are in high spirit. Even during these dire times, they are willing to support Hong Kong because it is their duty, their natural duty, to save patients. And they've been to different places in the mainland to save the lives of patients. And I'm really, really grateful for their assistance. And I believe that the majority of Hong Kong people also have the same feeling in their hearts, and that they are also very reassured about the mainland support team's arrival, because now we have more manpower available, and we also are touched by their passion in helping us. That's the end of today's press briefing. We'll see you again tomorrow at 11.